Hi, I'm Dr. Melissa Mandela, and we're going to talk about natural ways to treat mast cell activation syndrome. So mast cell is complicated. Are you someone who often gets migraines, headaches, flushing, you're feeling red, you feel like your heart rate is going to jump out of your chest, you're sweating all the time, and may have some digestive symptoms? There's so many overlapping symptoms with mast cell activation. It can be an autoimmune disease, it can be allergy symptoms, it can be neurology or GI symptoms. Oftentimes it can be confused when someone has hypermobility or Ehlers-Danlos syndrome, where one is extra flexible, like they can overextend their arms, put their thumbs all the way down to their hand, maybe touch the floor. And that can be hard to diagnose in a rush medical visit because no one in the traditional medical system doesn't have time to actually test those certain things and criteria and give the right questionnaires. It's so important to look for natural ways first for mast cell activation syndrome. You can look first if you have any environmental triggers. Is it in your room, in the kitchen? Is there some allergens? Maybe it's a plant. Is it a pet? Is it old laundry? Maybe some soaps. Look at the ingredients and maybe look at cleaner ingredients. Look for things that are paraben free. Look for those things that are actually what I call EWG verified. That's one of the first websites I recommend to my patients to see if they may have potential allergens or things that can potentially cause cancer, disrupt their immune system, and even their hormones, which is called endocrine disruptors. So you definitely want to look at that website. You can put your skincare in there, your cleaning products, and even certain food items. When you're looking at your allergens in your environment, it can also be mold, toxins, chemicals, smells. It can be dust. Check your filters. Check to see if you can put an air filter in there. And I do love Air Doctor, which I do have in my shop. So check it out. Now, the other things you want to look for is your food. Your food is everything because our mast cells reside in our gut. We have mast cells in our gut, our skin, around our nerve cells. So we want to give it nourishing food. You want to give it leafy greens. You want to give it fruits, vegetables, beans, nuts, and seeds. However, if you notice you're getting allergic to certain foods that are things that you used to love, or you're developing new allergies or have frequent allergies, you might have some histamine sensitivity or histamine intolerance, which is highly overlapping with mast cell activation syndrome. So look for foods that are lower in histamine. You may want to avoid those leftovers that are causing a histamine rush in your body, causing flushing, headaches, and allergy-like symptoms, and gut and bloating symptoms as well. You may want to watch out for not only old foods, but also fermented foods. If it's kimchi or sauerkraut or even certain yogurts, be careful. And also taking away the things that are very pro-inflammatory. And I often talk about this when I present my recipes, having my cooking show, showing you healthy, beautiful foods and avoiding those packaged foods full of additives, full of sugar, salts, heavy saturated fat. And that's usually junk food and things that just make people feel worse. And that's one of the signs that I can tell someone just isn't doing well, when they can't handle food when they eat out in restaurants or at someone else's house. They can only tolerate their own food. So you definitely want to do a cleanup in your kitchen, your pantry, and in your gut as a natural way to treat mast cell activation syndrome. Now, here are some basics that I'm going to start with when it comes to supplements, and then I'll share some more advanced supplements. You definitely don't want to ignore your vitamin C, which you can get from greens and bell peppers and fruits and vegetables, but you might need more to help your immune system. And of course, I do not only love vitamin C, but vitamin D. Vitamin D is so important for your immune system, so it can have the tools to modulate the stress and the immune dysfunction. Number 3, some type of heavy omega-3. So you can do that in the form of algae oil, flaxseed oil, or even a fish oil, which is more potent because it has the adequate EPA-DHA ratio. And that's really good for you because that can help reduce the inflammation, reduce some of the symptoms. Now, if you're extra sensitive to those, be careful because that means your mast cell activation syndrome is advancing and it's worse. You can try other things like turmeric or curcumin that can help the immune response. Or try things like quercetin and zinc, which are natural things to help your immune system deal with the histamine overload. I do love stinging nettle or bromelain, or something called D-Hist in the form of supplements. You can see my supplements that I tend to recommend in my shop. However, it can be very confusing because most people are sensitive to all those things, especially when they're in a flare. I do love NAC and acetylcysteine for not only the insomnia, the brain, the gut issues, but especially the mood issues that can help the anxiety. NAC cysteine, which is NAC, is a sister of glutathione, which is a powerful antioxidant which can help one's symptoms. Another thing I like to give is DAO, which is right before your foods and meals, so you can tolerate it well. The DAO enzyme is a good blocker of the enzyme that allows one to tolerate its meals. However, you may still struggle with all of these and you might need some medications. And this is where I come in. It's so important to go through these steps, but also go through it with an integrative doctor like myself. I often have to tease out all the foods, all the supplements, all the symptoms to get a clear diagnosis and get the right labs. Because one can get labs, but they may seem okay or normal, but there's still something deeper going on. And it's important that I look at the whole picture. Of course, you may have tried this already at home, taking an antihistamine, a Zyrtec, Allegra, Benadryl, and that could help a little bit. But you may not know how to dose it, how frequently to take it, and how much. So definitely want to get that checked. More advanced treatments can be steroids, and steroids are often given to patients in any allergy and any joint pain, autoimmune like picture, but they don't always work. Some people are given infusions, and these infusions can be very tricky because you need an allergist or you need it to confirm IgE mediated symptoms, and this helps a little bit. Other people need to try multiple modalities. In my clinic at Dr. Lifestyle, I use peptides and other compounded medications. And these compounded medications are called low-dose naltrexone, and dosing that can be tricky because some patients don't know when to take it and how much, and you can also have a response to it. But don't lose hope. There's an art to it. We help patients every single day, all day and every day for many years get better. And that's our joy at Dr. Lifestyle Clinic. So if you're having these symptoms, please come see me at Dr. Lifestyle, and I can't wait to help you. Thanks for tuning in. I hope you get more tools and tricks, how to treat your health, how to treat your disease, for mast cell activation syndrome, for your allergies, for your gut symptoms. And that's what it takes to get better. Don't lose hope. Don't give up. I'll see you next time. Check out my other videos on mast cell activation syndrome or on anything related to gut, mood, and food. And I'll see you next time. Thanks for joining. I hope you can like, tell a friend, subscribe, and we'll see you again.